I think we're good. We're going to get started today with the interRAI in action. So I'm going to kick this off with, I'll be the first person to say it, but you're going to hear it more times. We don't know that yet. Okay? So we do know some things, but we don't probably know everything or a lot of the things that you might want to know. But we do hope today that that you get a better understanding of why we're doing it. I know you've probably heard that to some degree. Hopefully we're going to just keep saying that because it is very important. I think you're supposed to take this, right?
Feel free to take my slide.
But I will introduce you. So I want to give kudos to these amazing panelists because the work that's gone into planning for the interRAI with the waiver modernization work and all that, including Monica, who's not on the panel today, but is here, has been a huge lift. And so Janet, thank you for putting yourself out here. Janet Stephan from the Department of DD. I'm not going to read her official bio, but this is kind of her project over there that is turning into, you know, lots of other people's projects too now, but definitely why Janet came over to the department. And we're really thankful that she came today because it is hard to present on things that we don't really have all the answers on. So thank you for being part of this. We got Holly Brugh from Summit County, Assistant Superintendent. She's been on that waiver, that group that meets weekly. It's amazing, along with Steve Oster, Superintendent of Knox and Coshocton. He's been super helpful. We have weekly meetings both internally within the county boards and also with the department to kind of work through next steps for getting the interRAI out, completing the assessment and everything. You're going to hear more about that today. And then last but not least, we have Jane, and I'm going to say your name wrong. I always say Farrar. Jane Farrar from SOCOG. She was at Ross County, I believe, in the past. I don't know where else, but she is at SOCOG now, and she is an actual interRAI assessor that was trained in the first cohort, and she'll be sharing an insight of her experiences doing the assessments in the last couple weeks and how it's going and all that. So that's exciting that we get to talk to somebody who's actually out there doing it. So I'm really excited to hear about that. So on that note, Steve, I think you're kicking it off. Okay.
Good afternoon, everybody. If you don't fall asleep because you had a good lunch, and if you do, that's okay. Things for today, we're going to understand why we're doing the interRAI assessment, which is important to know why we're heading down this path. Review the implementation and progress and timelines of where we're at so far. You're not going to hear today is how it's going to financially impact people or providers or outcomes. We don't know that yet. So if you're expecting to hear that kind of detail, not going to hear that today. You're going to hear lessons from trained assessors. So Jane's been out in the field working very hard. So you're going to hear how it's going with kind of families, people you're working with, SSAs, providers, all those people. And we're going to discuss implications for SSAs and person-centered planning. So that's kind of the objectives for today. I wrote a list down because I kind of want to bullet why we're transitioning. One thing we want to modernize that word. Thank you, modernize. Thank you, Christine. The developmental disability system. We want to do that for sure. We knew the DDP wasn't accurate any longer. It's not really a valid tool at this point in time. Everybody has switched away from it. We had lots of complaints about it. People could kind of finagle the tool to make it to people's benefits. So we wanted to get away from the DDP tool to something more reliable. We wanted some consistency across Ohio. So this tool is done by a handful of assessors who are trained in Ohio. They know how to do the tool. They know how to read the tool. They know how to score the tool. So it's consistently done among a group of people. So it's not everybody in every county kind of guessing how it works. It's actually validated. We want to use more data reliability and consistency across the current providers. We want to focus on the strengths and preferences of people, behavioral health, social services, cognitive needs, and the quality of life for individuals. We want to shift from what service fits into what helps a person live the life they want to live. And that's a question we don't get to all the time. We kind of fit people into stuff as opposed to helping them live their lives. And then the takeaway is it's not just a new assessment tool. It's part of Ohio's broader effort to build a more consistent, responsive, and person-centered system. So that's kind of where we're heading with this. It's been a fun venture with all of us. We've had some heated conversations between all of us, things that we don't like, things the department doesn't like, things that just people like or don't like. But we like each other working together to move this forward. I think we're making good progress at this point in time. I'm going to let Janet pick up the pieces in the middle.
Thanks, Steve. So I'll just explain how we got to interRAI. So as Steve mentioned, we heard a lot about DDP from all of our stakeholders, and that it was sort of falling short for us. So initially we looked at, potentially retooling that assessment. And then through this journey and exploration, we looked at tools that other states are using, tools that have been tested, normed, and that are reliable. So we looked at a variety of those tools and landed on interRAI for the reasons that Steve mentioned. Wanting to find a tool that is person-centered, that does capture comprehensively what a person needs, as well as something that would give us a good indicator of what we can expect someone to need in a year, several years. And so we can plan for that with services, and we can also plan for that with budgets. So I think I will hand it over to Holly to talk a little bit about that work and how we got here.
I want to apologize to the people online. We're having a few technical difficulties, so they can't see the slides, but they can see and hear you. So go for it, Holly.
Fantastic. Well, I'm just going to stay seated because my notes are on my computer. Okay. So as was mentioned, we formed a work group back in 2023. Our work group consists of county board superintendents, assistant superintendents, business managers, and other people from across the state in conjunction with DODD and Deloitte to really, it started to discuss a kind of a larger vision for waiver redesign in Ohio. Our selection of work group members was really strategic because we wanted to make sure information from the work group got back to each region in Ohio, and we gathered input that we could bring back to our work group to talk about and discuss. And then in 2024, our discussions really turned to focus on the selection of a standardized assessment tool. We looked at tons of options, specifically like what was being used successfully in other states. And then in 2025 kind of settled on the interRAI, and that is going to be the tool that Ohio is going to use moving forward. 2026, training began, we're finalizing details, but what I think is the most important to know is that our work group continues to meet weekly. We discuss all kinds of new information, make needed adjustments to current processes. I'm sorry, I keep turning away from the mic. But really, again, the purpose of that is just to ensure that information gets shared back with you for your thoughts, feedback, and input, and discussed at our work group. So we can provide a list of work group members. Hopefully you know who we are. If there are things you want us to consider and talk about, please feel free to share those things with us.
Unless you want to take the timeline, I'm happy to take that.
Janet. There you go. This is Janet's bread and butter.
Okay, so I'm sure if you participated in any of the town halls or seen any of the materials we have out on our modernization website, you've seen lots of timelines, and they, multiple things happening at the same time. So hopefully this makes it a little simpler as we focus on the interRAI tools specifically. As you all know, we have kicked off utilization of the interRAI tools. Assessors have been assessing for about 3 weeks now. Yeah. So we have started that, and we are collecting initial data from about 1,100 people, which is a representative sample. So somebody from at least every county, different age groups, different level of needs, all of that. So we're taking a look at those folks. And that will run through probably July-ish. Then we will start assessing individuals on the individual options waiver, prioritizing folks that live in congregate settings, so MRC settings, or shared living first, because in the implement stage, we will be gathering that information from the sample and looking at converting our current reimbursement structure, meaning a rate plus add-ons, into an acuity-based rate. And so those acuity-based rates will be applicable to the congregate HPC and shared living services first. We'll continue to do our work and look at acuity-based rates for other services, such as 15-minute unit, HPC, as well as adult day services, and roll that implementation in also. So we'll be assessing folks on the IO, looking at creating acuity-based rates. We'll continue to get through the IO waiver recipients and then start assessing folks on self and level 1. And hopefully we reach the summer of 2028 unscathed, and we'll make a full transition away from DDP and AAI and be using the interRAI tools for all enrollees. Add-ons go away, yes. Brave new world starting summer 2028.
Summer 2028,
Yes.
there we go.
Yeah.
Yep.
Okay.
Let's see, let me go to the next slide. All right, so current status.
Okay. The sample. So as of this morning, we have 225 assessments completed. So
Completed.
kudos to all of our assessors.
That's
Yes.
awesome.
Yes.
The quote up on the slide is, you know, the 350, but that's in progress. So that means
Yes.
we probably have even more in progress since you.
Yes, I think the number I received this morning was 625. So
Wow.
in progress means that the assessor has opened up the assessment and has started to review other assessments, level of care, Ohio ISP, DDP, et cetera, to help prepare for the interview process. So we're moving, which is exciting. So next steps to help us ramp up to complete all the assessments we talked about on the previous slide is we have our second cohort of assessors. So we have about another 30 folks that will be trained in Columbus starting the first week of June. We'll be doing some pre-work. And then the week of June, is it 9th?
Yeah, I
Yes.
actually snuck dates in because today on the big screen.
Look at you.
Yeah,
I'm
because your
looking at an
email
old
went
slide,
out.
so.
Yeah, your email went out. So yeah, I ended up putting them in there for
Yes.
people. So
Yeah.
June 9th, 10th, and 11th, and 12th are all in person.
Yes, yes. And for this go-around, we're incorporating the software training with the orienting to the assessment process and how to score the assessment. So I think we heard a lot of great feedback from our first cohort of assessors. And so, you know, the training's a little bit longer and a little more robust. So hopefully folks will come out of the gate feeling great about what's next. And then later in the summer, yes, you did not, I was going to say, there weren't
I also
dates on
gave
there.
dates for that. No, just
right.
kidding. Future.
Later in the summer, we will conduct what's called Train the Trainer. So we will be utilizing trained assessors from the department, as well as some of the assessors that are doing assessments now, to become trainers on this tool. So they can help support any additional onboarding, you know, due to turnover, growth, what have you. So we're sort of posturing ourselves to be on our own and functioning well with this assessment, you know, by the end of this summer.
Yeah, I love that. All right. Anybody just make note. I do want to say, you know, in full transparency, on our work group, we pushed for the 3-day training because county boards were like, nothing takes 4 days. And our assessors from the first training also told us, along with probably the department, that that was way too short. And that they would have appreciated another day. So apologies, because this one you're like, why is it 4 days? Why is it 3 nights away? That was the work group trying to figure out things, but we are glad that the second set will have an extra day to get some more good training. So thank you for that, to add that. And we're sorry for the inconvenience to the counties who thought it would be 3 days again, because that is hard, I know. So
Yeah. It'll be time well spent.
Yeah.
Right? Yeah.
all right.
Okay. So what about the assessment, right? So I'm going to pass to Jane here in a second, but the domains covered in the assessment are on the screen. So those under the Chime DD tool are specific to those taking that assessment, so for kids. It also incorporates all the domains that are under the ID tool. So that said, the kids tool,
It's long.
it's longer. It's longer than the adult tool, but for good reason, right? So kids developing lots of different things to take a look at. So that is what we cover. Before I turn it over to Jane, I think it's important to understand interRAI doesn't think of this as a questionnaire. And if you've been in a meeting with me, you probably heard me say that, and now we're starting to roll your eyes when you hear me say that. But they call each what we would call question in the assessment an item. So these are items to explore. These are things to learn about. So the assessment process is not just question and answer, right? So I think that's important to think about as folks see the outputs from the assessment and as you SSAs use that output as part of your planning process. But I'm going to turn it over to you, Jane, to talk more about it.
All right. Next slide, Jean.
Sure.
Okay. Maybe we're out on the next slide. We'll skip that one. And come
I'm
back
like,
to
that's
it.
not my slide.
There you go.
This is my
Yeah,
slide.
Yeah, it's okay. We're good.
All right, so I wanted to talk a little bit about the training. Lisa said it was a 3-day training, and there were 33 of us-ish, and probably 33 of us decided that we were walking out of there not feeling comfortable with doing this assessment in a couple of days. We did a post-training where we did a case study, and we walked through that case study as if we were doing the test for the person, because it was extremely important to the trainers and to all of us that we know how to answer the items in the same manner. And that's not to say that everybody's going to answer the same item. Answer is not going to be the same for the 4 of us, but we know how to determine what the correct answer is. Does that make sense? Now, there are some items on there that were like, okay, we all need to know this. And for instance, it's the intake date, just to give an example. We have the assessment date that we do it, and then later on in the assessment, it talks about an intake date. And in order for this state to be all together on that, we're using the waiver enrollment date as our intake date. And that was a simple one, because we're like, is it the day they came to service? Is it their span date start? Is it this? And we're like, let's make a decision, and we're going to stick to it, because it's extremely important to have that rate of reliability. The trainers from interRAI were wonderful. One of the trainers actually is one of the ladies that is redoing the booklet itself in the training manual. She has a big part in making sure it's capturing the valid information that we need, and we're not asking 1,000 questions that don't make a difference in the assessment. So she was taking notes the whole time, and she was really listening to what we are saying and what we're asking to make it the best tool possible. The difference between I know we talked a little bit about the difference between the DDP and the AAI. One question I've heard is, well, why you guys are all trained? SSAs are trained on the DDP. It's not like you're going in there blind. But it's such a different tool that the in-depth training makes a huge difference.
So an example on the DDP, there's a question about, I think about using like a microwave. Can somebody use a microwave? And depending on the county, someone will say, I can't use a microwave because microwave's too high for me to reach. But if you put the microwave on the counter, could use a microwave. People are answering that question differently in every county, which isn't fair. And when you go through those assessments, question after questions, people interpret them very differently, which is what makes the DDP sort of invalid over time, because everybody has their own interpretation. But if a microwave was on a counter and I utilize the wheelchair, I could actually use a microwave, it'd be a yes answer. But in a home where it's not, it's a no. So we're trying to get some consistency, and this tool does a lot of that for us.
Yes. And along those lines, as assessors, we are in an email group and like team chats to where if we run a questioning, we all give an opinion about it and talk about how it's going and how we've answered it and what problems that we've run into, if we have ran into any. And so we're all staying together on that. The interRAI responds to long-standing validity concerns, and they talked about that. The differences, if you just think about how many SSAs there are in the state of Ohio. They're doing the DDP for the people on their caseload. You can get 1,000 different answers out of 1,000 different SSAs. So the idea is to have a limited number of assessors to get the best answers possible that align across the board. So if you're receiving services in Meigs County and you're receiving services in Hamilton County, you're going to get the same level of service based on the outcome of this assessment, because we're all assessing the same thing in the same manner. And the one option that, or one item is with the interRAI is it captures complex needs more comprehensively. It includes behavioral, communication, mental health considerations. And I'm not exactly sure how many questions there are on the DDP, a handful. I do know how many questions there are on the interRAI. There's 292 items on the adult and 423 on the children. So it's, when I say it's comprehensive, it is comprehensive. It brings a holistic picture of the person, not just ADLs and IADLs. Can you use a microwave? Can you not? It talks about building strengths and resiliency, and it talks about companionship and what the person brings to the table. It's a really comprehensive tool. And what that will allow are the supports to be stronger for the collaborative action plans. Now, I hesitate to use the word CAPS, but it's so much easier to say CAPS because I don't want you to think when I refer to CAPS that it's a waiver cap, like a cap like we're used to hearing. So when you hear me say CAP, it has nothing to do with funding. It is the CAPS will go to the SSAs so they can take those collaborative action plans and see the ones that are triggered and build services around that. So that is what the definition of CAPS. And the interRAI will lay the groundwork for future service models and support structures being developed by the state that's consistent from county to county. So what surprised me the most was after going through the training, the trainers saying that it would be conversational instead of item by item. And I'm like, there ain't no way we're going to be able to have a conversation, and I'm going to be able to remember how to answer these items. They proved me wrong. They were very, very spot on for that. When we all walked out of that training, did we feel like we could do that? Absolutely not. Absolutely not. But after completing some assessments, it became clear that this is a conversation, and you can gather that information on what you observe and your experience as an assessor and your experience as an SSA, because I believe every assessor is an SSA.
Yeah, I think pretty much. We might have one or two in the next cohort that might be coming from a different role within case management, but yes, they're almost all SSAs. Well, they will be.
Yes.
And they will be an SSA, but it's where their experience is there may be one or two that are not, but predominantly it's been SSA experience.
And, we are used to having these conversations with the Ohio ISP and doing the assessment for that in a conversational manner. And just know that the more we do it, the better we will be. And when you can have those conversations and it doesn't seem like it's an item by item, yes or no thing, it builds relationships and it builds trust and it builds just a relationship with the people that we're meeting. Because, I work for a COG, and so I am doing these assessments in 12 counties. They don't know me. I don't know them. I go in and I introduce myself. We talk about the why of why we're doing this, how it's changing, and answer any questions they have off the bat before I ask the first item, because you have to build that level of trust, and that can take 5 minutes, or that can, in an hour and a half when I do the assessment, I walk out and they still don't trust me. I'll get better when I, you know, the longer I go. But it's building those relationships. Early lessons learned. I have a very funny story, okay? So they want us to do the assessments at the homes, which is understandable. Going into this, I'm like, I have got 485 assessments to do. If I could set these up at a county board and they could come to me and I could knock them out like this, doesn't that make more sense? Lesson learned. I tried that because the family didn't, my very first assessment, the family did not want me to come to their house. They didn't know who I was. Why are you coming into my space to do this crazy assessment, and you're going to be looking at how clean my house is, or you're going to be judging me on this and judging me on that, which we are not doing that. So I'm like, okay, I'm not going to fight you on it. I'll meet you where you want to meet me. So the assessment was scheduled at 11:30, and the father picked up his daughter to come to the county board to meet me at lunchtime, coming from a day program that she called school, which she dearly loved, and they were having chicken pot pies for lunch, which she missed. And she was not happy. And so she marched around this office, and she was pissed that she was not eating her chicken pot pie. And she found a box of Fritos or something, and she picked it up, and her dad's like, no, you can't. I said, she can eat those. If that's going to get her to sit down and, you know, we can have this conversation, she can eat 10 boxes of Fritos. And she picked him, and I said, well, if you just want to sit down, we can, you know, start this. And she looks at me, and she's like, thank you for the Fritos, but no thank you. And she walked right out of the office and marched off into the parking lot. And her dad is like, I am so sorry. And I'm like, you know, that's okay. She's not comfortable here. So why don't we set a time for me to meet you at your house after day program, and we can get this accomplished. And we did just that. And then it worked out really well, and she was wonderful. She was just a joy, and she gave me a hug when I left. So when we hear that there's ways to do this, there is always a reason why. And overall, people are responding pretty well. Knock on something, I've got 58 to do by myself by the end of June. So I have yet to have anyone not want me in the house. They've all been welcoming. They have questions. I'm not saying they don't have questions, but they're understanding the answers when they ask them, because there is a lot of fear around this. And there's a lot of miscommunication about what the tool will do also. And like the home visit question, I mean, that was a big thing that I've heard. And the gentleman, the father, must have heard it too, because the first words out of his mouth was, well, my house might not be as clean as you want it to be. And there are 5 questions on that tool, or 5 items that address that. And essentially, they want us to see if it's a livable condition. I mean, is the house inhabitable? Which we should all be concerned with if it isn't. They want to know if it's unsafe because of the clutter. Is it a fire safety? I mean, if they're in a wheelchair, can they get in and around? It's not judging how clean you keep your house at all. And they want to know if they can get access to all areas. So if, let's say they can't get up the stairs to the bedroom upstairs, maybe we might need to have a discussion about a home mod. If they can't get into the bathtub, or they can't get into the bathroom because they have a wheelchair, maybe it's another question about taking out a tub and putting in a shower. It's those types of questions that we're seeking to make the SSA's jobs easier to see how the situations are. We're not looking under beds. We're not seeing how dirty your house is, or if you have dishes in the sink or laundry to fold. That is not what we're looking for. We're looking to see if there's any services that are needed in the house that the waiver can help with, or the SSA can help with, to put supports in there. Some common concerns are, people are concerned that it might ultimately decrease their funding or increase their funding. And the ultimate goal is to align funding with the current funding levels and services that they're already receiving. So I believe that's why we're doing such wide sample, because we want to see what they're using now, what services they get, how the utilization is matching up with all of that, so we can build these services and supports. And no, we don't know what they'll look like, and some may lose some funding and some may gain some services. But ultimately, the goal is to make them align with what they're getting now. And the families should be encouraged to trust the process, ask questions at town halls and forums, and for them, let them clearly advocate for what their families need. Because I have been an SSA for, 22 years and been working in this field 30, and they still surprise me. Sometimes I go in and I think I know what they need, and then they're like, that's not what I need. You missed the mark. So no matter how much we as professionals think we know what they need, we still have to listen to them, because where they are at that moment might be different from where we think they are. And understand that change is difficult, and we just need collaborations from the family, providers, SSAs, and the assessors, because it's essential that we have this collaboration to make it successful for the people that we serve, because ultimately that's our goal. We want the best services possible for the people that we serve. And it's also important to correct misinformation. The assessment does not eliminate a waiver. It doesn't talk about level of care. It doesn't change what waiver you're on. It is to come up with a service structure to get the best services in place that accurately reflects the people's needs. And you can say, well, don't we already have that? I'll give an example. When I'm preparing for these assessments, I read through the plan, I look at documentation, and I was looking at the DDP, but I often found that the answers in the DDP were not reflective of the services that were written in the ISP. So an example is, on the DDP, it said this gentleman could not use a telephone. The ISP stated clearly that he calls and he texts, and that his phone is extremely important to him. And because of the length of the assessment, I'm like, I'm not really getting what I need from the DDP. Let me talk to the SSA, let me look at the service plan, go in, meet them, do the assessment, and then come up with the best answer for the items. Another question, is it just a way for Ohio to cut funding? And that's a very understandable concern, given I just sat in the HR, the Medicaid thing. As you were told earlier, they started rolling this out or looking at this years ago, like 3 or 4 years ago. So we're rolling it out at the same time we're having all these talks about Medicaid cuts, but that is not the reason we decided to go, or the state decided to use the interRAI. It has nothing to do with that, but it is a very common concern, and I think we need to address that. And it's understandable, but the timing is just a happy accident, I think.
Happy accident.
A happy accident. The state's goal is for the interRAI results to align with funding with the current funding levels or services that they're already getting. I keep repeating that, but I think it bears repeating. At the same time, when a funding model changes, outcomes can shift, and people may see a difference in their services, and that's okay too. But the full financial impact will not be known until the implementation is complete. And we are learning more about that all the time. And what if the assessment, another question we get is, what if the assessment doesn't reflect the person accurately? And that could be a concern with every tool we do. And one reason that I like the interRAI is it's a continual process. They take the answers, they look at it, and they see how valid it is. And they look at it across different states and across actually
Countries.
Internationally. And they are constantly making it an effective assessment to get the best services possible. And they look at it in a way where, because Ohio is using it for something totally different than other states. And that's another misconception. They think it's all used for the same reason. And if this state's having all these problems, then we'll have problems. And that's just not the case. We are building a way to use it in Ohio. And they're constantly looking at it. So when they take the redacted data, it's to make it better. It is nothing more than to make this tool more effective and hopefully reduce the number of items, because the time, I won't say flies by, but it takes an hour and a half, around an hour and a half, to do this assessment. And I've yet to do a child one, and I could imagine, because of the number of items on that, it will take much longer than to do an adult assessment. And then if you have an adolescent, so 12 through 18, there's another supplement that goes along with that. So they're constantly looking at it to make it as concise as possible to get the best information, which is a great thing that they're doing, because I think we came up with the DDP 20 years ago, and I don't think anybody's ever looked at it since then, to be quite honest. And the results should be used as a part of a broader person-centered planning process. And I believe later on there's like a sample, because we were all assigned a fake person. So when we pull up the assessment and look at it, Daryl Phillips is not a real person. And we're not like disclosing any information on our friend Daryl. But tips for the county board. So one of the biggest problems that I ran into is scheduling. And like I said, I work for a COG, different if they're county assessors, but basic things, contact information, correct telephone numbers, guardians' names and telephone numbers, residential addresses, not post office box addresses, and Monami, which is the software program we use, pulls all of that information from IDS. So IDS needs to be updated. Most of the counties in the COG use Britco. Britco needs to be updated. There is a wonderful tab in Britco called, it's a connection tab or something, and you can list every person and their address and their email address. And there is one county that I happen to work at for 17 years that does it exceptionally well. And I know if I'm looking at a Ross County person, I'm going to go to that tab and I'm going to see 10 contact people. I'm going to see their provider, I'm going to see their guardian, I'm going to see their doctor, I'm going to see this. And it is so helpful that I don't have to go search for that information, because we have a lot of assessments to do, and I shouldn't have to take, 3 whole days to try to get this information to schedule. And scheduling has been somewhat of a nightmare, because I travel from multiple counties, and I forget what county it was, but she had about the same number that I had to do. And I said, well, how do you get them scheduled? And she's like, I use a Google scheduling app. And I'm like, how? Tell me more.
Tell me more.
But she was in one county where I'm in 12, and I could see that not working for me, because I can't be in Pickaway County in the morning and Lawrence County in the afternoon. It just doesn't work. So that might work for some counties, but it doesn't work for us. So, but back to what the SSAs and county boards need to know, updated contact information is a must. As much information in the ISPs that you can put, because that's where we're looking to try to pre-work the assessment. How are we doing? Oh, we're doing good. I was worried that we would not have a lot of time. I would not have a lot of time.
You're
I guess
doing great.
I am like chatty. Some general information is the interRAI is a multi-source assessment, just meaning the assessors pull from documentation, we pull from SSAs, we pull from providers, we pull from their plans to get information across the life supports for the person. So we're looking at multiple things. It's not just a sit down chit chat with one person. And then it incorporates direct observation, document review, conversations with the input or from the individual, and input from the person who knows them best. And let me just touch on that for just a hot second. We do not want to do a team meeting when we do this assessment. It's not designed to be a team meeting. It doesn't work well if it would be a team meeting. It is me, the individual, and someone who knows them best, whether it's a provider, family member, guardian, best friend, somebody that knows them best. It is not designed for 10 people to sit around a table and go through this assessment. That's what the ISP process is for, and that's what the team process is for. And this is not designed to be a team process. The results, absolutely. You take those results and you meet and you go over them as a team. And we already talked about the domains and all of that. So if you want to, you can pull up the assessment real quick and we'll talk about that.
Yeah, I would just throw out there that depending on your county and who if you're using your own person or a COG, really communication about that process. I think I saw Steve Long is in here. I don't know, but I know New York. A lot of their counties are doing the scheduling for them because that's what they've decided to do, and it's worked out. Given they say we'll be in this area this day. So just make sure that you have really good communication with your COG and you have a good understanding of how they're doing it and how you can be more helpful to the scheduling. So,
yes.
Christine, we're going to wait on questions for a little bit. We still got some more stuff, but thank you. I will get you. Okay, so I think we were going to go to there's no way you guys can read this. I just wanted you to see, everybody's like, what does the results look like? That's what we all would like to know, by the way.
Right.
That has been a big conversation. So what they look like today is not how they'll look like in, a month or 3 months or whatever. So we screenshotted some of these, Jane, and just to kind of so you could at least get an idea. So I'm not sure what you want to share.
Just keep going to this is the assessment, what it looks like. And those are all, okay, right there. That I was talking about, I believe that's the caps, right?
Yep.
Or no, that's the scales.
That's the scale. Oh,
So the scales, think of it.
Let me jump in real quick. Oh. So the outputs that families and SSAs will see does not include scales.
Oh, okay.
Currently, because we don't know what that means, right?
So it's it's a number. That's why I was like, well, that's random.
Right, yeah. Exactly. And we don't want folks to think a high number is good or a low number is, because we don't know. I mean, we haven't seen data. We haven't talked through how those come to be via the assessment. So again, it's not about lack of transparency. It's just, this doesn't really mean anything to us, so certainly not to anybody else right now. Yep. So what we're looking at is what is potential output, and so when Jane's completed an assessment, she can view, her input this way.
And these are the caps. So if you look, it talks about every area that we assess, and then it'll say triggered or not triggered. The important thing to take away from this is if it says triggered, then that would be a discussion to build services around that are triggered. And if it's not triggered, then it's probably not a problem, and you probably don't need services in that area. And essentially, it's triggered or not triggered. Do we need to have a discussion about this, or do we not need to have a discussion about this?
I'll add in information that we don't have today, but we are working on it is the expectation that every county board would have CAPS manuals. I think some of you have been overachievers and have already gone out and purchased those, but that will be something helpful to SSAs, especially at the beginning, understanding something was triggered. This is what it said. What do I do service planning? Why? What do I need to go forward with Ohio ISP? How is this going to be helpful with me? So OACB is talking with interRAI about the best way to streamline those so that we don't have a million sitting around that aren't getting used versus ones that are getting used, electronic. I'm gathering information. We'll be sharing that with the work group soon to determine the best way to give you guys options and what you might. If you bought one, great, good for you. You're good to go. We're not trying to hide it, but we are trying to find a way to maybe make it so that when you call them, you know what you want and you have a plan, and it's easier for counties. So more information coming on that. Okay, let me go to the next one. That's the one that we really aren't even going to see. All right, let's go back to the one we skipped, Jane, before we do key takeaways, because it was kind of, I think this was more of just kind of the basic, intro to that idea of SSAs need to know. And I think, Janet, you and I were going to talk a little bit about that one.
Sure. So Jane has shared a lot of great information that is a lot to digest, certainly. So what we'll be working on, what Lisa mentioned, is with those manuals for collaborative action plans, providing additional support for SSAs to, those manuals will be great, but we're working on a companion document that helps sort of bridge, that sort of general language in those manuals to have it be more applicable to assessments that we use or places that when you're addressing the collaborative action plan. And I think Jane said it, and I'll say it again, is just because a cap is triggered, it doesn't mean the sky is falling, right? There's collaborative action plans around communication. So somebody might say they don't use a phone well. So it would just flag it for the team. This is something maybe you should talk about in the meeting, right? So we'll give you more guidance on that, and that's coming very soon. I think I have a final draft that I'm working through. So I would say in the next few weeks we should have that material for you all to review. The other thing I'll say, and Lisa, I'll turn it over to you, is this is an assessment like many assessments you currently use in service planning, right? OT evals, speech evals, medical records. This is just another tool in your toolkit for service planning. So while it certainly feels different to have independent assessors and receiving this back, it really, from my perspective, shouldn't disrupt service planning at all, right? You're going to continue, as you always have, with service planning. You'll just have another tool to use. We are getting ready to send out, I believe it's in this memo Monday, with specifics around how to share or how to give access to families in Salesforce. And I think that is probably very similar to directives around the Ohio ISP. Not an expert in that world. But I think it's similar guidance on how to give permissions so families can access that. We have spent a lot of time updating user guides for families as well, with how to get access to an Ohio ID, and then accessing the Salesforce platform. So that will be out for them to use also. So those supports are coming within the next week.
And for SSAs, they will be able to access Salesforce and get in to see the results also. And there is a future plan that OACB will be advocating, and I think the department already knows it, that there's an API built so that those could come from Salesforce into either BritCo or PSI or Core, so that it could be part of the plan, the results of it, again, just the results. But that is not going to be ready right away. So in the meantime, SSAs will be, if they want to see the results, which of course right now are somewhat, I don't know, not super helpful, a little helpful. We don't have any kind of funding associated. We don't have any kind of hours. We haven't, they will be going into Salesforce at this point.
But at least so folks can see.
But at least you want to see what does it look like.
Right.
Yeah, go in and look at it. Yep. And then I guess I just want to make sure that, one of the things that we hear across the state is SSAs and county boards and people, saying, I don't know anything about the interRAI. That's somebody else is doing that. Our COG is doing that. And then stopping conversation there. And I'm just, as SSAs or supervisors or managers, that is not helpful. you do own that these COG people are your people now. If you have somebody at your county, they're your person. I understand that answering questions is hard when you're not assessing, but we really need our SSAs to show confidence in the fact that this is a tool that is giving us good information, that is more standardized, it's updated, the DDP was outdated, and that we're happy to assist them and answer what questions we can, which are some of the resources that we've been giving out. And just that we will know more as we go. None of us know anything about the funding right now, but that doesn't mean that it's not still helpful in determining service planning, and that will be the goal. So just, I don't know what you can do. If you want me to come and talk to every county board SSA, don't say we don't know anything about interRAI. That doesn't go over well. I think if any of you look at social, we do know about it. What we know is that it is replacing the DDP. It's a more valid tool, and we're looking forward to that taking the place. As we learn more about what the results, then we will be sharing that with you. I mean, that's all anybody knows about it. So try to empower all of us and come up with those scripts for folks, because we really want those relationships, and that doesn't build good relationship in the county board system. It doesn't build good confidence in the county board system. So yeah, that's my soapbox. Welcome to my TED Talk. All right. All right, I think we have, the last thing is just resources. We have I put a lot in the PowerPoint, which will be available on Member Connect. You know, again, Janet, I don't know if you want to share that you have somebody besides you now that is also working within the interRAI, right? They moved, Renee?
Are we talking about Robin?
Robin.
Yeah. So Robin Norman is part of our policy division in MDA, and she will be trained in the next cohort as well on the assessment. And she will be the SME basically for technical assistance questions. So she's onboarding now, and that, you know, certainly in the interim, I'm happy to answer any questions you have. And I'll be including Robin in that, so she can.
Yeah, it'll be somebody else that the assessors can reach out to, the county board, if you have questions about logistics. Obviously, there's also redesign at DODD that you can email, and families can also. So I do want to get to Christine's question. I didn't realize it was already 56. There we go.
One question to ask, and I think even the service and support administrators would ask this question too. With this new assessment, are they going to have to go through a whole new psychological evaluation to show the current needs? Because how some people will ask that, well, my last one was 5 years ago. With this new assessment, am I going to have to go through a whole new thing to show my needs? Some service coordinators could ask that as, what paperwork are you going to need? The psychological evaluation, my physical, my test from my hearing doctor, all whatever, okay? They get, just curious.
All right, thanks for the question.
And short answer is no, we don't need those. We're not going to make you jump through any more hoops. We can look at what's already in place, what's in your file, and then we'll have a conversation about it. And the documentation, what we're looking for is a diagnosis that might already be in your file. We're not asking you to repeat it so we can get another answer. If it says you have autism, for example, then we check the box that you have a diagnosis of autism.
So yeah, that would be the only time you should, I mean, the psych is for level of care sometimes, right? There's that idea, but this is not replacing level of care. This is replacing the DDP, which it should just be your current functioning. So I think it was a great question. I assume you don't want to have to give all those things, right? Okay, well, the answer is you don't have to. There you go. Yeah, that's perfect. I'm not sure if we have time for questions or if we just want to like stop, and if anybody has questions, we could, I don't know, is there anything specific, Monica? Anything, nothing online? I'm sharing my screen. Oh, okay, you can't. All right. Okay, well, I think what we're going to do is, I know a couple of you have questions. I'm happy to take them afterwards, I think, since it's already 58, and we will go ahead and end today's. Please feel free to reach out to myself or Monica or Whitney at OACB about the interRAI. If you're looking for people at the department, you know who that is. We will see you back in this room in 15 minutes. Thank you very much.